Hello and welcome to After. Hello and welcome to Afternoon Briefing. I'm Patricia Karvelis. Coming up, Shadow Finance Minister Katie Gallagher joins me, plus my political panel a little later. But first, here are the stories we're following this afternoon. An unredacted Royal Commission report finds Cardinal George Pell was conscious of priests offending against children as early as the 70s. I'll be speaking to FrancisSullivan shortly. Confusion over how we'll be spending Mother's Day, with the state and territories relaxing restrictions at different rates. And South Australia records its first new coronavirus case in 15 days as COVID-safe downloads continue to rise. The country is awaiting tomorrow's National Cabinet meeting, where leaders will consider easing some coronavirus restrictions. In Victoria, the cluster amongst workers at a Melbourne abattoir has seen 13 new cases identified in the past day, bringing the total to 62. Anglicare has agreed to the Aged Care Quality Safety Commission's demands to appoint an independent advisor to help deal with the outbreak at Western Sydney's Newmarch House. Queensland has eased restrictions for Mother's Day to allow 5 people from one household to visit another. However, there's been no further relaxation of home visit rules in New South Wales or Victoria. The United Kingdom has become the first European country to pass 30,000 coronavirus deaths. It means the UK has the second highest number of recorded coronavirus deaths in the world, behind the United States, which has more than 70,000. And New Zealand will decide next week whether to further ease coronavirus restrictions. The downgrade to level 2 would mean restaurants could reopen as long as they respect social distancing guidelines, and professional sport could also resume. The Child Abuse Royal Commission has found Cardinal George Pell new priests were abusing children as early as the 70s and failed on 2 occasions to take action to remove them. Redacted sections of the inquiry's final report have been tabled in federal parliament. The Commission found George Pell would have known about clerical abuse by the early 1970s and later should have acted to remove 2 pedophile priests. FrancisSullivan is the executive chair of the Martyr Group of Hospitals. He was previously with the Catholic Church's Truth, Justice and Healing Council, which concluded its work almost exactly 2 years ago. He joins me now. Francis, welcome.
Thanks very much, Patricia.
The report condenses and makes conclusions about the evidence presented before the Royal Commission, focusing on multiple priests across many years who came to the attention of Cardinal Pell. It's delivered some very, very strong conclusions. What is your takeout from the findings? What stands out to you?
Well, first and foremost, I mean, it's a poor character assessment, not only of Cardinal Pell, but of many church leaders at the time, whether they were bishops or auxiliary bishops, even vicars general, people who are on consultors committees, anywhere where clerics were overseeing the behaviour of clerics. The Royal Commission made it pretty clear that the moral leadership of the church failed. And here we have again the impression from today's report is that once again, people who should have done something didn't do enough. And I have to say, after the 5 years of sitting through all the hearings, that was a very compelling impression I had. People in positions of responsibility in the church, whether they were a bishop or a religious leader, simply didn't do enough.
Cardinal Pell appeared before the Royal Commission twice. In 2016, he denied knowledge of abuse and said he'd been deceived in, and I quote, a world of crimes and cover-ups. But the inquiry has found that abuse was on his radar from 1973. So how can we reconcile his position and the Royal Commission's conclusions here?
Well, the first thing, Patricia, is the Royal Commission's findings are the findings. How individuals will reconcile their position with those findings is clearly up to them and their conscience. What's very important is that after 5 years of close examination, we've had significant people, including Cardinal Pell, being found to have known either snippets or other points of information. They've either talked about gossip, they've talked about the sort of vibe at the time. In other words, during the 70s, for example, there seemed to be a lot of people in the Catholic Church that seemed to know some things about child sex abuse, and yet no one went to the police. No one decided that the interests of children, the safety of the community, was more important than either the internal culture of entitlement and clericalism, or for that matter, even the image of the church. And this is damning. And the really important point, if I could stress this, Patricia, is that Cardinal Pell is one person. And sure, we need to focus on him like a number of bishops. But the Catholic leaders today, the bishops today, have been getting a bit of a free kick because the public concentration's been on Cardinal Pell, when we should be now looking at bishops today, religious leaders today. What are they doing to demonstrate there has been real change since the Royal Commission? What are they doing to give confidence not only to ordinary Catholics but the community that they are going to be transparent and accountable to authorities beyond themselves, Patricia? Because the days of the Catholic Church investigating itself clearly need to be over. And we can't have clerics overseeing the behaviour of clerics.
I take your point, Francis Sullivan, and nobody wants to provide free kicks to anybody who's not taking action, particularly after that damning Royal Commission. But this report finds that George Pell was conscious of the offending as far back as the 1970s and found that his priority was to, and you used this word, to avoid provoking gossip. How did this approach inform the Church's response in the years that ultimately followed?
Well, two things about that. I think, firstly, that him saying that he didn't want to promote gossip, I suppose implies that he knew of it. And secondly, if he knew of it, he didn't do enough. So I agree with the Royal Commission's conclusions there. Secondly, the Catholic Church leaders after 1986 kept on telling us all they were not part of the problem but the solution. And in the Royal Commission over those years, what they put forward as their solution was demonstrated to have failed on many occasions. So the learning for us all is that unless there can be an independent, arm's distance approach by the Catholic Church to how it deals with matters of child sex abuse, including how they deal with people coming forward wanting compensation, wanting pastoral support, wanting to be believed, until the community can see that there has been a sea change and that the personalities of the past no longer influence the policies of today, I don't think they'll get the trust.
Reading this now unredacted report that's been released or allowed to be released by the Attorney General based on that legal advice, how did what we read in this influence the Church's official responses through the Melbourne response and Towards Healing?
I think two things. The Towards Healing process, as I understand it, took a number of years to put together. There was a paradigm shift led by the then Bishop Geoffrey Robinson that shaped a pastoral response based on the needs of the victim. Far less legal, far less informed by the insurance company. Because prior to that, the Church had been in massive risk management mode and had been taking the advice of lawyers and insurers, even advising bishops and religious leaders not to meet with victims, not to admit that anything had gone on. Classic sort of risk management corporate style. The Melbourne response was likewise very legalistic. People were even having to turn up in legal chambers to tell their story, even though the individual they spoke to was a very compassionate barrister. It was still had a very legal, tight arrangement with very defined compensation payments and the like. So it seems to me that the years of the 70s and 80s, which were completely controlled by the risk management approach of the church, still influenced how the church approached things post-1996. And let's face it, the bishops actually, as it turns out, are meeting over these days. And I hope when they come out of these days, not just looking for white or black smoke, I hope they come out of these days with a new policy altogether about how they're going to be facilitating an independent investigation and settlement of claims.
Now that the Commission has found that George Pell was aware in the 1970s, can we look at George Pell's handling of abuse complaints, handling of victims and families through a different prism with fresh eyes?
I don't know. I think I have to say this. In my dealings with George Pell throughout the Royal Commission period, I found him to be extraordinarily cooperative and determined that the church put its best foot forward here and made sure it cooperated fully with the Royal Commission, explained itself and so on. He was pretty determined to have a particular style of compensation and investigation instigated when he was in Melbourne. I don't take the view that it was a process designed just to make the payments by the church less than they could be. I don't take that view because across the board, whether it was towards healing or the Melbourne response, the general payments were only about 50 or 70,000. And it's only when the lawyers for victims really got going that the church was brought into the real world and had to start paying some much more generous compensation payments. I think you could look at it as being a moment in time in the change in the attitude of church leaders about becoming more accountable, even though I don't believe we're at the desirable point yet.
The publication of this report, what purpose does this serve now?
Well, the first thing it serves is public accountability. I mean, this is a Royal Commission that went for 5 years. I believe it was probably the most heavily resourced ones we've had. It was exceptionally important because it was addressing what we all now realise is a massive social blight. And it gave people who had been abused some hope. It also, I hope, has given people who have been abused in the Catholic Church some sense of value, that they are important, that their story is exceptionally important to the health and the future of the Catholic Church, because without their bravery, without their prophecy, the Catholic Church would likely still be deluding itself. Secondly, having a report on the public record enables others to examine it closely and to start to see how entrenched power operates in the Catholic Church, how entitlement through clericalism operates, how cast to the side lay people are in the Catholic Church when it comes to the real decision making, and how sexuality in the Catholic Church can become so dysfunctional to the point of being abusive.
FrancisSullivan, you said at the beginning of the interview that we need to be careful not to give current bishops a free kick, that we need to hold them to account, essentially. I'm sort of paraphrasing there.
Sure.
Do you believe the current church leadership is going to pay heed to the conclusions in this report? What does it need to do now to show accountability to what's been published today?
I think that's the first point here, Patricia. There is a tendency in the Catholic Church when it gets tribal to find all critics as being negative. And some of those tribal reactions turn on the media and say, oh, the media is just being too, is victimising the Catholic Church once again. And they'll use any opportunity to do that. If that mentality prevails in the church leadership, then they've learnt nothing. Secondly, ordinary Catholics at least are expecting their bishops and religious leaders to sing literally from a new song sheet, to demonstrate that we didn't just put up with a Royal Commission, we're learning from it. Do you know that Catholic bishops and religious leaders have not even had 2 full days of actually workshopping the results of the Royal Commission 2 years after it's reported? And I would be very concerned if they dismissed today's final report as, oh, well, it's old news. It's not old news. It's actually a cameo of the culture where abuse was unfortunately rampant, where concealment was the modus operandi, and where looking after your mates was the unwritten code within the clerical caste. We can't have that.
FrancisSullivan, thank you for joining us this afternoon.
Thanks very much, Patricia.
FrancisSullivan is the Executive Chair of Martyr Group of Hospitals. He was previously with the Catholic Church's Truth, Justice and Healing Council, which concluded its work almost exactly 2 years ago. We have contacted Cardinal Pell's advisor a couple of times today. We understand he is reading through the many pages of the report and not making a statement as yet. We've also invited Father Frank Brennan and Greg Craven to speak to us, and they've both declined. More than 700,000 coronavirus tests have been conducted in Australia. To help health workers deal with the pandemic, Chief Nursing and Midwifery Officer Alison McMillan says a new mental health program for staff will provide support around the clock.
We are also now reporting more than 700,000 tests across Australia, and we continue to see that increase in testing. And we're really pleased to see people presenting, even with minor symptoms, for testing across the country. Today, we've also announced the start of a program for supporting healthcare workers. And the Black Dog Institute is going to be providing that support on a 24/7 basis, as is the nature of our healthcare, to healthcare workers to support them in the amazing work that they've been doing across the country in keeping us all well and safe. So again, a reminder to all of us of the importance of both looking after our physical and our mental health in this time of uncertainty.
More than 5.2 million Australians have downloaded the federal government's COVID-safe contact tracing app, leaving it just shy of the Morrison government's 40% uptake target. Malcolm Crompton is the founder and lead privacy advisor for Information Integrity Solutions, and he's a former Australian Privacy Commissioner too. Malcolm, welcome.
Thank you very much for having me.
You've said the missing link in terms of legislation around this COVID-safe app is that the Commonwealth law is highly unlikely to apply to state agencies. What specific problems do you see arising from that?
And I have learnt a lot since I made that statement, Patricia. There's a real issue in our federation of when and how Commonwealth law can reach into the state agencies, the agencies run by the states, whether it's police, education, health, anything like that. It's a perennial hard question. What's happened since I made that statement has been that we have seen an exposure draft of the actual law that will be passed by the federal parliament, hopefully next week, to deal with that issue and a number of other issues that were a bit of an open question at the time of the ministerial determination made by the Health Minister, Mr Hunt, a little while ago. And there's a constitutional concept called covering the field, which is that the Commonwealth can make its laws in such a way that it does apply more widely and, if you like, pushes the state laws to one side, but it's very hard to do, and only if it's constitutional within certain areas. And so one of those areas in the Constitution is actually quarantine, which is where the Biosecurity Act comes from. In this instance, in the bill, they've worked very hard at making sure that this law will actually apply to health officials in state health agencies in a binding way, and more importantly, that the federal regulator, the Information Commissioner, is able to apply that law and enforce that law and audit against what they're doing. So I think they've made a much better start than I expected. And really, Patricia, I think the issue is actually going to be in the implementation. You can only take law so far. After that, you have to see how it's actually going.
Would state parliaments legislating help in that process?